Hi, my name is Ben Lamb, or Benjamin formerly. I am a consultant urologist in the NHS. I'm half-time at Barts Health and half-time at University College Hospital. I specialise in prostate cancer, and I'm prostate cancer lead for Barts Health. And one of the areas of expertise is also robotic surgery. I offer patients robotic prostatectomy. I do Retsia sparing prostatectomy, nerve sparing, and have also begun to use NeuroSafe during operations. So the reason I became a doctor, I was very interested in science when I was at medical school, um, and I've always been interested in working with people and the application of science to humans, and medicine seemed the obvious choice for that. So that's why I chose to pursue a career in medicine. So the reason I became a urologist, I think in part because the people I worked with early in my career who were urologists were very inspiring. They were very nice people, they were enthusiastic, and they enjoyed their work. And that's always makes it very attractive. As I got into my training, I realized that I very much enjoyed surgery. I enjoyed the craft of surgery, doing something creative, something with my hands, but at the same time helping people. And becoming a urological surgeon then followed from there. I think I was very lucky in my training that when I was a senior urology trainee, robotics really came to London for prostate and bladder cancer care. And I had an opportunity to go and work at University College Hospital back in 2014 with people who I'm now colleagues with. So I had a really good training in robotic surgery at an early stage. I went to Australia for a year for a fellowship in Melbourne to further refine those skills. And since 2018, I've been a consultant with a busy robotic practice. So I think every day I find rewarding. I know it sounds like a cliche, but my job as a consultant is pretty varied. There's obviously the surgery, which I love. That's probably my favorite day. The operating is really being able to do something constructive, something that's almost a craft or an art form, but at the same time helps people, gets rid of their cancer, and you do your best to give them the best quality of life afterwards. I also do several clinics, so meeting people, explaining things to them, listening to them, finding out what their priorities are, and then helping them to make decisions about where to go with their treatment. I also have some kind of management and leadership roles, which I find really rewarding because I'm able to contribute to improving patient care, improving the way we deliver care in the NHS on a wider scale, influencing greater numbers of people. So the whole thing's great, and putting it all together is a really rewarding job. So feedback I've had from patients is generally positive, and I try and actually get feedback from everybody, not just cherry picking people I've had a particularly good relationship with. So I like to think the feedback I receive is very honest. Um, I think patients value the fact that I listen, that I take in what they say, that I am concerned about what is important to them, what their priorities are, and what motivates them. I try to explain quite complex, medical ideas and things about treatment in language, fitting it to the patient and their understanding, and then try and advise people in a kind of open and honest way about what might be best for them, what the pros and cons of different options are, and really trying to tailor the, what might be the best treatment option to what suits the patient best. My mantra in my personal life is happy wife, happy life. That's stood me well for many years now. But at work and in other parts of life, I think I like Gandhi's phrase, "Be the change you want to see." So where I think things can be improved, where things need to be done differently, where I can be of help to people, I like to put that into practice and do that in a practical way.